Today I'll be showing you how to do medication administration with a sub-Q injection. The first thing you always want to do when you're doing any kind of medication administration is to check the doctor's order against the MAR. You want to make sure you have the right patient, the right medication, the right time, the right dosage, and the right route. Once all of those check out, you can start getting your equipment that you'll need for your injection. For a sub-Q, you can use a 1 milliliter or a 3 milliliter syringe. Or if you're giving insulin, you can give an insulin syringe. Show you. And then you have your needle. Make sure you pick the right size needle for the job. Okay. You'll also need gloves, alcohol swabs. Okay. And once you have all that, you're ready to go into the medication room. Once you go to the medication room, you want to make sure that you check the patient's chart or order or MAR, and you're gonna do 3 checks. The first check is you check the right patient. You make sure you have the right patient. You make sure you have the right time and order, and you'll pull your medication and make sure that it's for the right route. Once you pull your medication, that's your first check. Then for your second check, you're going to make sure that you pull in the right medication, also following your 6 rights of medication. Once you've determined that you've picked the right medication, it's time for you to get your medication ready. And for your vial, you'll use an alcohol swab and clean the top. Once you clean the top, you'll grab your syringe and needle, and however much the medication order is, you want to pull that much air. I'm gonna use 1. Trying to make sure that you don't touch the inside of this. Okay. And with your medication, you want to put that much air into your vial. Lift up, and what you have, without touching the inside again, you want to make sure you have the right amount of medication. And what you want to do is you want to check to make sure you don't see any bubbles. If you see any bubbles, you can lightly tap. Okay. Lightly tap until the bubbles are gone. That's when you want to use the scoop method. Use the scoop method and make sure you close this until you're ready. Once you have your medication, you can grab the rest of your supplies, your alcohol swab, and your gloves. And if you do have the insulin, you can grab that. And you're ready to go to the patient's room. Once you go to the patient's room, you'll knock and introduce yourself. Hi, my name is Jacob Deckard. I'm a student nurse, and I see the doctor has ordered a sub-Q injection for you today. Okay. And that's when you can wash your hands. And you can use the identifier. You can use the bracelet and ask the patient their name and date of birth, and you match it on their bracelet. And also, if they have a picture with you, you can use the picture to cross-match and make sure that's the right person. Once you have that, you can wash your hands. You can put on your gloves. And you want to do your third check to make sure you have the right patient, the right medication, for the right route, the right time, and the right dosage. And you're ready. And you're almost ready for this. You want to pick the correct site. And for a sub-Q, they say a good place for a sub-Q injection is the abdomen, the stomach. And if you do that, you can do a 45-degree angle, or you can do a 90-degree angle depending on the surface area. So you'll clean that area, making sure that this is dry. And once you have that, you can go again at a 45-degree angle, and you want to aspirate. Make sure there's not any blood. I don't see any blood. So I'm going to inject, take out. And you want to put this in the sharps container. And if you want to, you can put a band-aid or you can put pressure on a gauze, and that'll be okay. And once you've done that, you can take off your gloves, throw those away, wash your hands, and that's when you want to document. You want to document your 6 rights and where you put the site where you gave the injection, which will be the stomach area, your stomach area, abdomen. And once that, you can clean up. And after you document and clean up, you're good to go.